Now at 10:30, Boston 25 News gets real about kids and mental health. For more than a year now, 25 Investigates has been reporting on how kids in crisis often end up stuck in hospitals. It's called boarding. That's when a patient waits in the emergency room for a psychiatric inpatient bed. As investigative reporter Kerry Kavanaugh found, that wait is even harder when a patient is also on the autism spectrum.
Every single time we went to the ER was a traumatic event.
Traumatic events that were devastating to Jen Drowan and her Southborough family.
My son Sam is a 18-year-old who has autism and some comorbid mental health issues, including ADHD, anxiety, depression.
When you have a child who has developmental disabilities and now mental health needs, can you describe what it's like to find that kind of help for your son?
Just complete and utter hopelessness.
I think the pandemic has hit the autism spectrum disorder community harder than it has any other population.
Dr. Yael DeVere is a child and adolescent psychiatrist at UMass Chan Medical School's Kando Center. That's the Center for Autism and Neurodevelopmental Disorders.
It is significantly more likely that a youth with a diagnosis of autism spectrum disorder or intellectual disability will board in an emergency room for a longer period of time if they require an inpatient stay.
According to the Massachusetts Health and Hospital Association, 619 people, including 78 pediatric patients, were boarding in ERs or on other medical floors as of July 5th. With specialized services on hold during the pandemic, the population on the autism spectrum has been especially hard hit when it comes to mental health episodes. And Drowan tells me Sam, who asked me not show his face, began experiencing bouts of frustration and aggression even before the pandemic. He boarded in hospitals 4 times in 2020.
We were discharged on March 17th when the world was completely shutting down with nowhere to go. We had already been in an 8x8 room for 7 days, and we found that there was nothing coming up on the pike.
For many, the ER's the only place to turn to, though not always the best.
We have come home worse than when we came in.
It's going to be important and crucial that we develop a hybrid system of being able to provide in-person services and telehealth services to meet the level of challenges that all of these kids have.
David Cochran's the director of the Kando Center, which does have resources specialized for kids with autism spectrum disorders and emotional health struggles on an outpatient basis. I asked what needs to be changed. Cochran says more community-based centers and mobile crisis teams are a must, or these vulnerable kids will continue to face a system that can't meet their needs.
Even prior to COVID, kids with autism spectrum disorders were 9 times more likely to present to an emergency room for psychiatric concerns and 6 times more likely to need hospitalization than kids without autism.
Kids that Drowan says need help and understanding.
We have a responsibility to not just sit by and say this is a broken system.
To fix it, Drowan believes the state needs more clinicians that understand the intersection between disabilities like autism and mental health. We checked with state agencies that track psychiatric boarding patients. None is tracking how many of those people have a developmental disability. For 25 Investigates, I'm Kerry Kavanaugh.